As the effects of the new variant Omicron blooms, following quickly after the Delta variant a few months ago, NDC's political leader does not believe the 2022 budget prepares Grenada to survive and overcome COVID-19, noting only an additional $2.2 million increase for health when compared to 2021. Dickon Mitchell says it signals that the NMP administration is happy with the state of healthcare in Grenada. Mitchell also notes that the health minister's presentation lacked substance.
One would have expected that the presentation would have focused on the steps and the measures that will be taken via the financing of the Ministry of Health to strengthen our capacity to treat with and deal with COVID-19.
NDC's leader said not much mention was made of the National Sustainable Development Plan, which encapsulates measures to improve healthcare.
The National Democratic Congress would have therefore been guided by that plan in relation to its allocation, its budgetary allocation for healthcare. That plan highlights at least 32 action points that are required to put Grenada in a position where it has improved and sustained healthcare.
Regularizing the status of nurses on contract, NDC's political leader says, should have been one of the first measures taken, bringing an end to one of the major issues within the sector.
They deserve job security. We need them to bolster our health sector, and we cannot afford the risk of the constant migration of our nurses to foreign lands because they are not being paid adequately.
Prime Minister Dr. Dickon Mitchell, in his contribution to the budget, had announced that some of the 162 nurses on contract will be regularized next year.
43 of them have been regularized to date, and our efforts continue, so we understand the problem.
Permanently increasing the number of ICU beds at the General Hospital given the challenges of COVID-19, expanding and upgrading community health care centers with a heavy focus on the Sister Isles, NDC's leader believes should have been prioritized. For NDC, the political leader says 2022 would have been the start of a 3 to 5 year plan which involves increasing the wages and benefits for all healthcare workers to ensure retention to adequately staff the health sector. Making full use of the diaspora and HDU alumni in approving healthcare would have also been NDC's focus. $97,056,168 have been allocated to health, while the overall budget for 2022 is $1.3 billion. I am Gerard Joseph for GBN News.